Hello, welcome to TvAgro. My name is Gabriel Rojas. I am a veterinarian from the veterinary clinic Auto Vet. Today we are going to talk about a topic that is very common in pets, which is the sterilization and castration in them. The sterilization normally refers to the process of ovaries hysterectomy in females in both dogs and cats, and castration, its technical name is the orchiectomy in both cats and dogs. Everyone asks us if it is necessary or mandatory to perform it, and really from my point of view is not mandatory. We have had patients who reach 15 to 16 years without spaying or neutering in the case of females and arrive without any pathology concerning the subject. Then it is not mandatory. However, my criterion is to perform preventive. Why? Generally both spaying and neutering are done preventively to avoid unwanted pregnancies and really to avoid overpopulation of pets. However, nowadays this has improved a lot, and the responsibility we have over our pets has changed compared to previous years. So we are almost managing this issue very well, too. We also do it to avoid unwanted behaviors, or when the pets already have unwanted behaviors, let's say to make them change those behaviors. That happens more than all in the case of the males. For example, the dogs that are aggressive, the dogs that bark a lot, the dogs that are very anxious, that are suddenly very anxious, doing the castration that really consists in removing their testicles by means of a surgical technique. We make that the hormones mainly, or better said the testosterone, lowers its levels in blood. That is going to allow us to say that the behaviors of being the alpha male, of being very territorial, decreases. Then that is why castration is recommended in dogs for that type of things. In cats it is something similar. Cats have a behavior that is really unpleasant for most owners, and it is that they begin to urinate everywhere. And it is not that they urinate as such, but they make a process of marking that they raise their tails as if they were eliminating like a spray. And it is urine, and it is a very strong smell that in most cases, as I commented, is not pleasant for anyone, and by neutering it at an early age or spaying it after doing that, there is the probability or the possibility that they will stop this behavior. That is why we also recommend castration. And the third one, which for us is the most important, we can avoid diseases in the future, which we will discuss in detail later on, and which diseases we could avoid by performing this type of surgical procedures on our pets. When there are many studies, theories that indicate that before the first heat, others indicate that after the first heat. A myth is that the dogs must have a puppy to be able to be operated. That is a myth. My recommendation is to do it before the first heat. In puppies we recommend between 5 and 6 months of age depending on the breed, because there are breeds that have their first heat when they are 8 to 9 months old, so we can do it at 7 months in this type of breeds. But the ideal, or from my point of view, is to do it before their first heat in both cats and dogs, and in males the same. For both species I suggest to do it between 7, 8 or 9 months of age, to avoid the unwanted behaviors that I talked about before. Like, well, let's say that this type of surgery is common. This is a surgery like any other type of surgery that should be done by a veterinarian. The ideal is to do it in an operating room with all the hygiene and asepsis measures. Here at Auto Vet, what we do, we take pre-anesthetic exams to verify that they do not have anemia, that the platelets are fine, that their kidneys and liver are apparently working very well. After that, there is a preparation process where we cannulate them, we give them saline, antibiotics, analgesics, anti-inflammatory drugs, and we start a pre-oxygenation in most of the cases. After that they enter a pre-medication, and here in our operating room we intubate them. We put them in an inhaled anesthesia equipment with oxygen. Multi-parameters, function pumps and all that with a minimum of oxygen. Function pumps and all that with minimizing risks, because unfortunately all the procedures that involve anesthesia and sedation carry a risk, and for that we here do a series of procedures and protocols so that the risk is minimized as much as possible. And what diseases we avoid doing this type of procedures? Well, in the case of females in both species, felines and canines, we avoid 1. Pyometra. Pyometra are reproductive diseases that, in short, is that their uterus fills with pus, and it is a very severe infectious process that can put the life of our kittens or dogs at risk. Normally the uterus of a kitten can be half the thickness of my finger, and when they have a pyometra it can be much wider than my fist, and all the content is pus, so it can be very risky. That is why the recommendation to sterilize. The other diseases are like uterus cancer, ovarian cancer. By doing this type of procedures we avoid this type of alterations. Polycystic ovaries also. By doing this type of surgeries, this type of situations will not happen, and mainly in a disease that nowadays unfortunately is becoming very common and more is coming to our offices is mammary gland cancer. Studies have been made comparing dogs that are sterilized at an early age and those that are sterilized at such an early age are less likely to develop mammary gland cancer when they are adults. Patients that are more than 8 to 9 years old that are not sterilized are more likely to develop it than if they had been sterilized. That is why the recommendation is to do it. And in the case of the males we avoid diseases related to the prostate. Generally the dogs that are not sterilized and that have advanced ages generate something that is called prostatic hyperplasia, and is that their prostate increases in size, and that leads to urinary problems, recurrent urinary infections, problems to be able to urinate. In severe cases they can cause tumor processes in their prostate, and the prostate in our pets is very difficult to manage. The surgical option is very difficult nowadays in pets, so that complicates their condition a little bit. And other diseases that we avoid is testicular cancer, which is very common in adult patients, so that is our recommendation. To perform this type of surgeries, it is not mandatory. I reiterate. We have patients that reach the age of 17, 18 years and do not have a problem related to their reproductive system, but unfortunately, we find more diseases related to that. So the recommendation is to perform ovarian hysterectomy in our cats and dogs, and castration, which is its name, orchiectomy, in our dogs and cats in order to avoid pathologies and diseases in the future. The surgery could really be called an ambulatory process, and we here at Auto Vet, in the case of the males, we operate them in the morning hours. They stay part of the morning with us, all the afternoon with us, to evaluate that they do not have an inflammatory reaction, that there is no bleeding. In the case of the females, it is a slightly more traumatic procedure, because we enter the abdominal cavity. Our hands in the surgical technique can touch viscera such as their kidneys, small intestine, stomach, etc., so it is slightly more traumatic. So it is a little bit more traumatic or more invasive procedure. Therefore in most females we prefer that she stays one night with us in the hospital to manage pain, inflammation, to see that there is no bleeding and that the anesthetic recovery is the best. After she goes home, the recommendations in most cases are to administer anti-inflammatory analgesics. The antibiotics are left to the doctor's discretion, and depending on how the surgery went, how it went, if it lasted long, if it did not last long, then the antibiotic, sometimes depending on the case we send it home. We formulate antiseptics on the wound so that with gauze they can make a very good cleaning. A healing cream to help us to accelerate the healing process, and something very important, but that for the owners is something annoying and for the pets too, is the Elizabethan collar. Because generally the complications after this type of surgery are very common, is that the dog licks the wound, the stitches are removed, it gets infected by licking, so the Elizabethan collar is a fundamental part of the treatment to avoid complications, and we really need quietness in the homes of the dogs for the first 3 or 4 days. After that, you can start to live their life in a normal way, and in the case of the males, both the expenses and the dogs really rest for a day in nothing. Simply, if you see any type of secretion, inflammation, bleeding, you have to report it to the doctor who performed the surgery to see what could be happening. But in this type of procedures we do not really have any major complication. Unfortunately, everything that involves anesthesia and sedation carries risks, but the idea is to minimize as much as possible. Also, the recommendation is to perform this type of procedures in your pets in a preventive and not curative way. Also, if you have any doubts about this type of procedures, you can contact us in our social networks of Veterinary Clinic Auto Vet. I also have my personal network Gabriel Rojas Vet. There you can consult us for any information you need on this topic and many more of your pets. Thank you very much, and we hope to see you in the next time of TvAgro.